And welcome back. Well, here on the Morning Blend, we've often talked about spider veins and varicose veins. Today, though, we're going to tackle the worst type of vein problem. They are called venous ulcers, and today, how to spot them and treat them. Dr. Deborah Manjoney is with the Wisconsin Vein Center and MediSpa.
Hi.
Good morning. Nice
Thank you.
to have you. So these are kind of way beyond the cosmetic problem.
It is. I mean, you know, frequently when I'm on, we talk about beauty and we talk about what we can do to make ourselves look better, but now we need to talk about some medical problems. And venous ulcer disease really is kind of the most extreme type or manifestation of problems with the veins.
Now, is it fair to say then that this is not a problem that's difficult to detect or diagnose, because this is right at the skin surface,
You
right?
have an open sore.
Okay.
Okay, and a lot of people used to call these open wounds.
Okay.
You know, and my aunt had an open sore that didn't heal, things like that.
Uh-huh.
Now, it is sometimes difficult to determine if it's from a vein problem or an arterial problem, you know, an inflow problem from the arteries or an outflow problem from the veins. But we can do that with ultrasound. We can tell what's going on.
So what does it look like? What is the problem?
The problem is the skin will not heal because it's become so damaged from long-standing vein disease. When you have venous insufficiency or a backflow problem in the veins, a buildup of pressure in the veins, frequently what happens is the leg gets very swollen.
Okay.
And when that happens, the tissues get damaged permanently.
Oh.
And so you can get discoloration of the skin, you can get a thickening of the skin, and you get a breakdown of the skin. So, or if they just bruise themselves or injure themselves, the skin will break open and then it doesn't heal because the lymphatic drainage is delayed. There's so much swelling that healing cannot occur.
So how do you treat this problem then?
So the way we treat this problem, first of all, is with an ultrasound, so we can diagnose what's going on. Now, oftentimes venous ulcers just have to be treated by keeping somebody in a compression stocking.
Okay.
And then treating it locally with either antibiotic solution or wet to dry dressings or other kinds of dressings that we can do. But the thing is, we need to look and see what's going on in the veins, because if it's a deep vein problem, there may not be anything we can do, but if it's a superficial vein issue, there are all kinds of things that we can do to help the healing because we're improving the venous drainage of the leg.
I know sometimes you need ultrasound to detect
Yes.
the severity of a problem. Is this the case? Even though it's at the skin level, you still need that?
We definitely need the ultrasound to see which veins are functioning and which ones aren't, and to direct us to where we can treat the veins that aren't working properly.
Now, as far as goals for treatment and fixing this problem, obviously the compression stockings are going to get swelling under control.
Right.
And that would be a primary goal. What about contamination or like an infection of some sort?
That can certainly happen. And like in one of those cases we saw, actually it was a rupture of a vein underneath the skin. And so she had, you know, a kind of clotted blood at the surface that became a big scab. So there are things that we need to do to be able to treat the wound. But sometimes the wound won't heal if we don't treat the underlying vein problem. And that's what people don't understand, that they're always going to have this ulcer or it's going to keep recurring. Many times they'll heal and then they come back. And so we look to see if there are some veins underneath the skin that can be treated that are going to keep these ulcers from coming back.
We've talked about wonderful advancements in
Yes.
treating veins where you can do an in-office procedure.
Right.
Is that sometimes the case even with this serious vein problem?
Absolutely it is. Not all ulcers can be treated with just in-office treatment, but almost all can. And there are really now some very wonderful types of products available that we can use to help decrease the bacterial contamination that you get from having a chronically open area like this and help speed up the healing. There really are some very good products that help, especially once we can get the swelling under control and get the underlying vein problem controlled.
Is there any way that people can actually prevent this from happening in the first place?
Well, if they have chronic swelling in the legs, they should be wearing a compression stocking. So they need to see their family doctor or to come to a vein expert so they can be fitted for vein stockings, you know, or a compression garment of some kind. And that will help keep the swelling down so that they don't get to this end stage problem where the skin breaks open because the leg is so swollen and the skin has gotten so leathery that it can't heal properly.
Is there anything you can do through vein detection if someone comes to you with swelling to hopefully prevent that problem from ulcering and becoming a problem on the outside?
Absolutely, and that's what we do many, many times. Once we have the information from our ultrasound, we can then treat the problems in the veins and prevent them from getting ulcers. 20% of people who have varicose vein disease will develop ulcers in their lifetime. And so it's very important to treat varicose veins, especially if you're having any of the symptoms of swelling or changes in the color of the skin where it's getting more pigment because of the blood that's just static there in the leg going to the surface and staining the surface. So if you have staining of the skin, if you have swelling, those are kind of the things that you see right before you can have ulcers start.
Okay, so that's staining of the skin or swelling in that area. Those would both be reasons to come and see a vein specialist or your regular physician.
Because this can happen otherwise.
Okay, and then it can happen again too.
Yes, it can. It can recur. It's often a problem.
We're going to give people information so that they can get a consultation on their veins. The Wisconsin Vein Center and MediSpa is located in Pewaukee on Georgetown Drive. The phone number for more information is 262-746-9088. Or you can visit their website, wimedispa.com. Nice to have you this morning.
Thank you, but it's nice to know there are things we can do for this.
For sure, especially things in office, which is exciting. Thank you.